Good afternoon, everyone. So my next video is on the topic of leprosy, that is drug treatment of leprosy. Now I'm going to discuss with you leprosy. And before I start my video, I want to request you, if this video is useful to you and if it is helpful to you, kindly subscribe to my YouTube channel. That is Dr. Nitika Hans Pharmacology Discussion. And now I'm going to start with drug treatment of leprosy. Now, first of all, I will discuss with disease. That is, it is the chronic granulomatous disease principally affecting the skin and peripheral nervous system. Means it is the chronic granulomatous disease and it affects the skin and peripheral nerves. And it has been caused by it is infection of Mycobacterium leprae. Skin lesions are seen and deformities in the fingers, toes, and peripheral nerves are involved. These are responsible for the stigma attached to leprosy. The earliest description of leprosy and its treatment comes from India around 600 BC. Arameus Hansen discovered Mycobacterium leprae in Norway in 1873, and he named this disease as Hansen's disease because he discovered this disease in 1873. So that's why this leprosy is also known as the Hansen's disease. Now, there is new cause of leprosy, that is Mycobacterium lepromatosis, was discovered in 2009 in Mexico and Caribbean. And humans, these are the primary reservoir of Mycobacterium leprae. Leprosy is not a highly infectious disease. The principal means of transmission or route of transmission is by the nasal secretions in the nasal and oral mucosa. Incubation period is between 6 months to 40 years, or it may be longer. Pathophysiology is caused by the acid-fast bacilli, intracellular acid-fast bacilli, which is present in granulocytes, and it enters the nerves. And areas affected in leprosy are nerves, basically the superficial peripheral nerves, skin, mucous membranes of the upper respiratory tract, anterior chamber of the eyes, and testes. These are the areas involved. That is superficial peripheral nerves, skin, mucous membrane of the upper respiratory tract, anterior chamber of the eyes, and testes. Tissue damage is extensive in leprosy, depends on the degree to which cell-mediated immunity is expressed. Means in leprosy, the cell-mediated immunity gets suppressed, and bacillary spread is increased, and there's a multiplication of bacilli takes place in leprosy, and there is tissue damage. And there is a Lepra reaction seen, in which there is type 4 type of the hypersensitivity reactions and type 3 type of humoral antibody type of the type 3 reactions are there, basically affecting the cell-mediated immunity and humoral immunity. And nerve damage is there, and other complications can occur. And if the leprosy is untreated or if it is severe, it can lead to a significant deformity. Antibiotic treatment can improve the patient's outcomes. And if the leprosy is early diagnosed and if antimicrobial treatment is given, it can arrest and it can cure the disease. Classification. Leprosy has been divided into two types, that is tuberculoid leprosy and lepromatous leprosy. Tuberculoid leprosy is the leprosy in which there is few bacteria in the skin and nerves are there. It is the limited disease in which there is few flat, slightly raised lesions of various sizes. They can be pale in color or slightly red, dry, hairless, and numb to touch. It means there is anesthesia in the skin lesions, and these are raised skin lesions, and they may be flat or they may be slightly raised. They can be pale in color or slightly red in color. Skin lesions are present like this: the red in color anesthetic patch, hairless patch, dry, red in color is present. This is the tuberculoid leprosy. Lepromatous leprosy is the generalized condition. It is present all over the skin. diffuse involvement of the skin, there is thickening of the peripheral nerves, and there is also involvement of other organs such as eyes, nose, testicles, and bone. The organs may be involved, the whole skin may be involved, and the peripheral nerves may be affected. There is skin thickening of the peripheral nerves, like the whole face is involved. There is skin lesions, a lot of skin lesions are there, ray structures are there, and nerves are involved. Diagnosis is the skin smear for the Mycobacterium leprae, which forms the basis of simple classification. In Paucibacillary leprosy, the skin smear is negative and there is less than 5 skin lesions are present or fewer skin lesions are present. In multibacillary leprosy, the skin smear test is positive and the skin lesions are more than 5. This classification is now used worldwide for treatment purposes, like the classification leprometers, borderline leprometers, and mid-borderline. If this type of leprosy is there, then there is multibacillary leprosy. If there is borderline tuberculoid or tuberculoid, that is paucibacillary leprosy. This is leprometers. A lot of skin lesions are present, or more than 5 skin lesions are present, and peripheral nerves are involved. This is the tuberculoid, means less than 5 skin lesions are present and there is red or pale colored raised skin lesions are present, which can be hairless and which can be anesthetic, and these are dry in nature. Single lesion, paucibacillary leprosy. If there is single lesion, that is the paucibacillary leprosy. Therapy. The goals of pharmacotherapy are to reduce morbidity, prevent complications, and eradicate the disease. Means we have to reduce the disease condition, we have to prevent the complications, and we have to eradicate, completely cure the disease. Drugs first line are the Dapsone, Rifampicin, Clofazimine. Other antimicrobial drugs which are used in multi-drug resistant leprosy is minocycline, ofloxacin, and clarithromycin. So first of all, clofazimine, it is the leprostatic red dye. It binds with mycobacterial DNA. It is anti-inflammatory in nature. It is not given as the monotherapy, it is given in the combination. It penetrates the cell membranes and macrophages. And it is also stored in adipose tissue and skin. Half-life is 70 hours. Adverse drug reactions of clofazimine is reddish-brown discoloration of the skin, photosensitivity, dry and itchy skin. This is used in the multibacillary leprosy, that is in the leprometous leprosy it is used, and in atypical mycobacterial infection and in Lepra reaction. Lepra reaction is basically when we give the Dapsone as the treatment. When Dapsone is used in the treatment of leprosy, there is a side effect. As the side effect, we can say the Lepra reaction occur, and in these we can give the clofazimine. Dapsone, which is bacteriostatic in nature, and it is the sulfonamide. It is just like sulfonamide. It is the folate synthase inhibitor, and it competes for PABA, that is para-aminobenzoic acid. It is not useful as monotherapy. It is widely distributed, and adverse effects will be skin rashes, fever, jaundice, Lepra reaction, and uses all types of leprosy chemoprophylaxis of the falciparum malaria. Paucibacillary as well as multibacillary leprosy. In both types of leprosy, that is leprometers and tuberculoid, we can give this drug, that is Dapsone. Rifampicin is bactericidal for the Mycobacterium leprae. Its minimum inhibitory concentration is 1 microgram per ml. Single 600 milligram dose is highly effective. WHO multi-drug therapy, widely followed widely in many countries, highly successful in controlling leprosy under varying conditions. Relapse rate with multi-drug therapy is very low. Low frequency of adverse drug reactions are seen. And the advantages of WHO multi-drug therapy is that there is reduction in frequency and severity of erythema nodosum leprosum, which is the Lepra reaction, which is the type 3 type of the Lepra reaction, that is humoral antibody mediated Lepra reaction. And there is anti-inflammatory effect of the clofazimine. Clofazimine is used in the treatment of Lepra reaction. Multi-drug therapy can prevent resistance to Mycobacterium leprae to anti-leprosy drugs. And this treatment can prevent the resistance to Mycobacterium leprae to anti-leprosy drugs, also effective in the treatment of relapses. Adults with multibacillary leprosy, the treatment is on the day one, we have to give rifampicin, clofazimine, and dapsone. Rifampicin is given in the dose of 600 once a day, and 300 milligram tablet is available, which is given 2 tablets for the rifampicin once a month, that is on day one. Clofazimine is given 300 milligram once a day, and that is 100 into 3, that is 100 milligram tablet. Tablet is given, 3 tablets are given, and dapsone 100 milligram is given. Daily treatment, we have to give the drug. This is given in the supervision. This once a month drugs are given in the supervision of the healthcare professional. Let's say rifampicin and clofazimine is given under supervision of the healthcare professional. And this daily treatment is taken by the patient by itself on the days 2 to 28. Clofazimine is given 50 milligram. Dapsone is given 100 milligram. And duration of treatment is the 12 months. Means 12 blister plaques are available. Means after every 1 month, the patient comes, and this monthly treatment is given in the presence of the supervisor. And this daily treatment, the patient takes by itself. Now, this is this is blister packs. Clofazimine 3 tablets are given of 100 milligram. Rifampicin 2 tablets of 300 milligram, and dapsone 100 milligram 1 tablet is given. Adult Paucibacillary leprosy, monthly treatment day 1, rifampicin is given 600 milligram once a month, and dapsone 100 milligram daily is given. This was the earlier treatment. Now clofazimine has also been added as the monthly treatment of the Paucibacillary leprosy, that is 300 milligram once a month can be given. Daily treatment days 2 to 28 days will be dapsone 100 milligram daily, and clofazimine 50 milligram is also given. Duration of treatment is, it is the treatment of 6 months, that is 6 blister packs are available. This is for the Paucibacillary leprosy. This is in the children of 10 to 14 years. This is the Paucibacillary child blister pack and multibacillary child blister pack. Once a month, 2 capsules of rifampicin, 300 milligram, 150 milligram, 1 tablet of dapsone, 50 milligram. Once a day, 2 to 28 days, 1 tablet of dapsone, 50 milligram. Full cost 6 blister packs are there. And for multibacillary, once a month, 2 capsules, 300 milligram and 150 milligram of rifampicin, 3 capsules of clofazimine, 50 milligram each, and 1 capsule of 1 tablet of dapsone, 50 milligram. Once a month, once a day, that is daily, is given 1 capsule of clofazimine and 1 tablet of dapsone. And this is given for the 12 blister packs. Now, single skin lesion Paucibacillary leprosy, it is affecting in the adults. It is given rifampicin 600 milligram, ofloxacin 400 milligram, minocycline 100 milligram. This is single doses given in the adults for the treatment of single skin lesion multibacillary leprosy. Lepra reactions are the acute inflammatory event occurring during the disease. These are of the type 2 types, that is reversal reaction occurs in Paucibacillary leprosy and multibacillary leprosy, which is the type 1 reversal reaction, which is the delayed type of hypersensitivity reaction, that is type 4 type of hypersensitivity reaction. And type 2 is erythema nodosum leprosum reaction, which occurs in severe multibacillary leprosy, and it is the humoral type of the type 3 type of the hypersensitivity reaction. Lesions, they become swollen, red, and tender. Nerves are enlarged. Other organs involved are the eyes, joints, bones, kidney. In type 2, in the erythema nodosum leprosum, the organs may be affected. Now, this is the multibacillary leprosy, erythema nodosum leprosum. There is swollen, red, tender, nerves are enlarged, lesions are present. Type of reactions, treatment of reactions will be by the salicylates, that is NSAIDs and chloroquine or NSAIDs. Thalidomide is used in severe cases and it inhibits the tumor necrosis factor alpha release. Absolutely contraindicated in women of childbearing age. These are absolutely contraindicated in women of childbearing age. A high dose of clofazimine as an anti-inflammatory agent, although it is slow acting and toxic if given in these doses over long periods. Means we can give the high dose of clofazimine, that is 200 to 300 milligram per day, because it has the anti-inflammatory action. And though it is slow acting and toxic, we can give this drug in the severe conditions. Corticosteroids are useful in patients with neuritis, eye complications, and orchitis. Multi-drug therapy is continued with corticosteroids, since steroids may promote the viability of the Mycobacterium leprae. Other anti-inflammatory agents like cyclosporin, cytotoxic drugs have been used in difficult conditions. Means these immunosuppressant drugs can be given, and this anti-inflammatory drugs can be given in difficult cases. Thank you. That's all for the treatment of leprosy. I hope you understood this video. And if you understood this video, I want to request you kindly subscribe to my YouTube channel. This is Dr. Nitika's Pharmacology Discussion. Thank you. Be happy, be safe, be healthy, be happy, be blessed. Thank you. Stay safe.